the clock, but.
Good morning.
It's a adjusting process, but here we are. Top of the morning, welcome everybody to our March Health and Human Services Board meeting. I appreciate being everybody agreeing to a week later. When you have a meeting before actually the 15th, our staff doesn't have all the information that they should. So I think your events having a meeting closer to the middle of the month helps some, doesn't it?
Yeah.
Yeah. So I think we made some progress there, Plus. I appreciate it. We'll call the meeting to order, and number 2 is approval of the agenda as presented. Is there any questions? As presented as is, moved by, and we have a second. Second by Joe. You got that, Madam Clerk? All in favor, say aye. Aye. Approved. Approval of minutes of January 12th. As we didn't have a meeting in February, everything went all right. So, morning, Rita.
So moved.
Second. Approved and second, all in favor, say aye.
Aye.
Approval as presented. Disclosure, I don't think there's any conflicts there. Mr. Administrator, is there any public comments? Don't know of any, Madam Clerk. There's nobody registered, and okay, so we'll just move on. Information, supervisors not seated. I don't think there's anything there. Morning, Dr. Lagos. We're just opening the meeting. Update on Golden Age Manor. Who's on the agenda for that? Oh, by the way, we have Tanya is.
I'm taking Tanya's place, Kathy, business and
So
operations.
do you want to introduce yourself and
Yeah,
tell us a little bit about?
I'm Kathy Jingers, business and operations manager for the community services division. So we do a lot of the budget stuff and everything for the division. So Tanya was busy today, so I'm taking her place.
Well, welcome. We're glad to have you. Welcome anytime. So do you want to, have you got a report from?
I do not, and I do not see that Dana is on her. So
Vince, have you been in touch with Dana? Things are all right there as far as the vaccines and everything?
Yes and no. We've had some good reports on the healthcare and so on. Nothing new there. We did have what they call an eloper, where a person walked out of the facility that should not have. And I can tell you that Dana and her staff are very good at this, and this is an unusual circumstance where somebody got up and walked out.
I haven't heard of it.
Well, and they brought the person back, and everything is fine and safe, but we take that very seriously, and so she has put together a strong action plan to say, didn't think this could happen or would happen. It did. It happens on occasion, so they're taking steps to correct it. So I think it's something that we need to keep our eye on, but she's done a great job. So
As long as everything is back safe, we're very lucky, very fortunate. Do you have anything on the percent of capacity? Are we around 90%?
no, well, I think we've dropped significantly from, say, a couple of years ago. I don't have that exact number, but it has been down.
Yeah.
Can I ask a question? Vince, is everyone vaccinated now, all the staff and all the residents?
The staff should be, I don't, and the residents, and again, I apologize, I thought
That's
somebody
okay,
would be.
that's all right, I'm just kidding.
I think the only thing would be is if there's anyone under 16 that is working there,
Oh,
just because they aren't eligible. And obviously people can say no. Workers, yeah.
Yeah, I think way back in January, they were pretty well, the staff and everyone was pretty well I got my second shot in January already, and they were quite a bit ahead of Wisconsin. You're gonna give a report later on catch up on that later on. Update on veteran service offices. Here we are. You want to introduce yourself? You got the floor.
So I don't have many updates, but I'm Andy Butzler, the Veteran Service Officer. Downstairs, everything's kind of business as usual. Just give you a few updates on Minneapolis VA. So sounds like they're doing a phenomenal job on getting veterans vaccinated. They're currently, excuse me, currently working on veterans 18 and older with certain health conditions, and then any veteran 65 and older. Also, if you're, like frontline workers and things like that under the age of 65, I encourage you to contact them to get a vaccination. Exciting news with the Rice Lake Community-Based Outreach Clinic. They have plans to relocate sometime this year. We don't have a lot of information yet, but if you're familiar with Rice Lake, they're going to be relocating to the old Shopco building. Supposedly, they're bringing in radiology to where they can then handle those types of services as well. So it's great news for Polk County veterans that utilize the Rice Lake VA, with me being one of them as well. So it's great news all around for that. That's really all that I have.
So I participate on, it's the Polk County Housing Committee. I can't think of the full name. And one of the things that came up the other day, it's all this repair money that's available for housing. And she said, spread the word. Do you know about that? And should I get you the flyer? Because they
So is
have,
that the HUD Rural Housing and Development? I'm aware of that program.
I can get you that. I mean, it was through the, well, it's considered HUD money. I don't know. I could try and get that. Tim has it.
Yeah,
actually.
so Tim did send me that information as well, so I
Oh, he
think.
did. Okay,
Yeah,
so then you got it. Okay, good.
correct, yes.
Okay, that's all. Yeah. it was
Amy,
supposed to-
I'm not familiar with that either. Where did that come from?
What is the committee that I'm on? It's CBD, blah, 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 housing.
Oh,
And so
Joe, is that the housing that you resigned from, the elderly
Well, Housing
development?
and Development Program, if I remember right.
yeah, I think that's right. And they have money for repairs in Polk County in the Northwest region. We were kind of mid to
Well, that's
low.
West Cap that does the repairs.
Maybe they do the implementation.
Yeah.
And she did have money and I was like, I'm gonna tell Andy about it.
I believe Jay Luke is the new representative to West Cap. And they'll come in and they'll make a energy survey and different things. And sometimes they'll do insulation, sometimes they'll They'll
They
even-
just have repair money. I was like,
prices and everything, yeah.
And then speaking of repairs, of course, we have what's called the Veteran Service Commission Fund as well. So I don't know if everybody's aware of that. If you run into veterans or surviving spouses that need assistance with, whether it be, utilities, it could be basically anything, an emergency situation. We have funds available to assist with those needs. So if you come across veterans, widows, send them our way. Glad to help any way we can.
Thanks for taking care of our veterans. We
Absolutely,
appreciate
it's a
it.
pleasure.
And I think it's up to us as representatives to talk to some of these veterans and some of the people in our communities. We are the resource, and if we can say, hey, stop over to our veterans office or just give them a call, and if we get them a phone number sometimes or something, we can just be of assistance because they don't know that things are available.
And that's an excellent point, because we do get a lot of calls for other resources. Just because we may not be able to assist them with it, or it may not be a program that we do, we can definitely connect them with who can answer their questions or assist them with those needs.
Usually that intermediate communication that is really the key to getting something done. So, thank you much. update regarding our COVID-19, Madam?
Yep.
You want to?
Yep, I have some numbers here. We put some stats together. As many of you know, we have been, and some of you have actually volunteered there, been doing our drive-through clinic with Burnett County. That started on 1/28. So if you look at our stats from 1/28 through last week, 3/11, we have administered 3,945 doses. 2,696 of those were first doses, and then a total of 1,249 people have received their second dose. Then we're doing another additional 200 first dose this week and 300 second doses, so 500 more on top of that. So it's been going pretty smooth. You know, we're working on that each week, I think streamlining a little bit more. We've kind of gotten our timing down, so it's been going great. At this point in Polk County, 66.5% of our 65 plus population has received at least one dose of COVID vaccine, and 33.3% have had 2 doses. So right now, when we look at the positivity rates, the state does it on a 7-day average, and currently the data is from 224 to 39. For the positivity rate for Polk County is 5.6%. For Wisconsin, it is a little bit lower at 2.2%. So we are a little bit higher than the state average. But overall, I know they've seen a lot less positive tests come in each day. That's the data I have. I mean, I could try to answer any questions if you have any.
Wanted to comment, I've been voluntarily giving vaccines there, and the organization has been great. It keeps getting better every week, you know. Great. Well, thought out. Just got to get people in there.
I particularly want to thank Amy. You and Rita both have been doing some vaccines.
He's got the important job of poking people. Well, I just tell them where to go.
All the jobs are.
I know,
So it's really well organized.
It really is. I just want to echo her. I have never heard, and Vince has said this before, I have never heard so many positive things about something. And everybody, so I see them at the end of their experience. I'm at the parking lot holding area, recovery area, and I walk up and down the hall. Steve Warrendahl's there almost all the time, and we're both chatting with people, and everybody is so happy. They're just like appreciative. That was easy. They don't have to get out of their car. And the staff, I mean, you guys have done an amazing job coordinating all of these. I mean, how many volunteers are we using? You know,
between 40 and 60, depending on the length of our vaccine, you know, and we've added more the last few times to kind of streamline that process to find where we can find efficiencies to get it faster for the customer too, so they don't have to wait as long and make it clear to where they need to go. So 40 or 60.
We did have a challenge, I will say, last Wednesday in registration, when Tanya and four others of us were trying to put up the 10th in the ring. There was a piece missing, but we got it. We figured it out. We improvised.
Yeah.
We got it up.
The other thing I wanted to quickly comment, I was not familiar with this Weaver system and the Wisconsin volunteer sign up that you can be available for any volunteer opportunities that come up. So being on that's also really well, very systematic.
You have a target date, like say May, June or anything, when just the general public can, like down to school kids and
Well, right now, there's no vaccine that's approved for below 16, so 'cause it's emergency use. So I'm not sure if that all depends on what, with the guidelines for that, FDA and everything. As for that, it just depends on as Wisconsin allots the different.
that's what I
groups.
meant. And what kind of information do you get from the state pipeline?
So right now we have essential workers. I know most of the teachers in Polk County are getting it starting this week at the schools. Starting even today, they're doing strike teams out at the schools. We have then started seeing, you know, people who are on certain Medicaid programs such as Iris, they are now eligible to come through the line. And then also essential workers for agriculture, farming, that type of thing. So that is opening up. I have seen the state talk about in the upcoming weeks, the next guidelines were people with underlying health conditions. But that's just really waiting for the state to put that guidance out there and go from there. And then also making sure, this is kind of the first week we moved beyond the 65 plus because we wanted to focus on that priority group first. So just looking at the big picture as we go through it. So I know a lot of our area providers are still focusing on their 65 population, where we have opened it up to some of those other groups.
So you'll go from 65 down to 55, and then after that, it'll be,
Nope, it's 65 plus, and now we're doing the next eligible groups, which included your teachers, daycare providers, some of your, like, people that work in infrastructure and agriculture, they're now eligible.
so you're thinking that high school and college kids, there's really none of them that are,
Not at this point unless they worked somewhere. Like I know, example, if anyone worked at Golden Age Manor, they would have been able to get it. So right now we just have Moderna, which is 18 plus, where Pfizer is eligible for 16 plus. So I know there are some surrounding, like St. Croix County has Pfizer. I think Chet's and Amory now has Pfizer. BMC has Pfizer. So we have partnered with them with like Golden Age Manors. They've had some 16-year-olds that wanted the vaccine. We sent them somewhere else where they could get that. So right now there isn't any vaccine available under 16.
Who determines which vaccine we get here at the county?
We put in a request and we can request a certain kind.
Oh, okay. Now, do you also work with the, like, the different communities have public libraries? Do you work with the different libraries? Because some libraries are open and some aren't, I'm finding out.
I think that's they can call and ask for guidance within our public health team, but I think some of that comes up to what they decide to do on their own.
Dr. Lagas, do you have any information that you'd like to share?
Well, I think, yeah, the question of the vaccine, I think they're all good. All three of them are good. And it's just a matter of supply, how fast we can get the supply. The reason we can't really get the Pfizer vaccine here, I don't think we have storage capacity where we can keep it frozen at minus 90 Fahrenheit. So I think that's why we're getting the Moderna vaccine, because I think the Pfizer vaccine really belongs in Madison.
Correct.
Maybe Eau Claire.
VA is using.
Yeah, we are not, you know, and now Johnson & Johnson is out and we are starting to see that more in this area too, but which is a single dose at this point.
And so whatever vaccine you can get in your arm, that's the one you should take.
Yeah.
And I was thinking this morning, I said, you know, if we can, more people we can encourage to get vaccinated for whatever reason they don't want to, that's going to make it much faster to open our schools, colleges, technical schools this fall. Start the 4th of July and Labor Day picnics and keep everybody safety and keep our hospitals empty from COVID patients.
Dr. Loggins, are you seeing the variant around here yet? Some of the three variants that we're kind of watching in the Twin Cities?
I don't know offhand, because I'm not sure that we can test for it. So this
No, we
would be
can't, right.
more something that needs to be tested in our more major cities like Eau Claire and Madison.
Do you think that one of the next steps will be to encourage workforce places, say like Polaris and?
Yep. So I know we are also working on a grant with the ADRC, I believe, so to kind of focus on those, whether it's the Amish community, tribal, that type of thing. So we're working on that right now. I think that's due on Friday. But then we are also working with our area providers because they can put strike teams together and they're willing to go out to some of the maybe manufacturing type things. So we have been working with our area providers on establishing that and what that looks like. So yes, to make it easier to go into a workplace than have them try to come sporadically wherever. So yes, that would, if we can find partners that are willing to do that, yes.
And our strike teams made up of these clinics or some of us, some of Connie, some.
At this point,
Kathy, I can chime in if you would like as well.
yeah, oh yeah, Jean's on. Go ahead. There's
Hi, I'm Jean. I'm the new public health director. I'm sorry I'm not in person. I had to jump off from another meeting to get to this one. But just your question about businesses, most businesses will probably start becoming eligible here by March 29th, or they may be eligible now, just depending on the criteria. And we're working with our local vaccinators to see how they want to handle um, vaccinating businesses. So it's really up to the business themselves and how they would like to do it. The state is looking into possibly doing it the same way they did for health educators, where they vaccinator sites worked with local public health departments to order vaccines. A survey went out today that's due tomorrow about businesses. So we should have more information to come. But right now it's still just if a business wants to work with a local vaccinator site, if they're eligible, they can come through our drive-through. It's just really where they're going to go to get that vaccine.
So you're the new gal that Tanya was excited about. Can you take a minute and tell us, did you have the experience from Milwaukee or someplace?
Yep, I came from the City of Milwaukee Health Department. I worked there for 6 years. I started as a lead risk assessor and worked my way up all the way to our management in that program. In the lead program, it did focus a lot on lead, but I also established our lead and water program. I have a very strong environmental health background. So I did tons of community outreach, a lot of partner creating, establishing new partners. And then from there, I joined our emergency preparedness team to help prep for the DNC that didn't happen. So instead, we prepped for COVID, and I helped establish a lot of our testing sites and working on the processes of like mass vaccination as well. So prior to the health department, I did 8 years of environmental consulting, traveled around the world. So I'm very excited to be here. It's been a lot of fun to work with the staff, getting involved in new projects. I was amazed at the vaccine clinic that they set up here. It was really impressive to me. So seeing all your good feedback is really encouraging that I'll share with staff, but it's been great. It's refreshing to be up here, starting a new role. I also love the environment outside, so I'm very excited to be out in more of a rural area versus in a city jungle. So definitely very excited.
Well, we're just excited to have you. You're probably the youngest person with as much experience as you're talking.
Yes, and I love to be challenged. So this is something great for me with all the different things that are going on in the county. Like Kathy mentioned, we are hoping to apply for this health equity grant the state it has offered. The application's due on Friday, and we did partner with ADRC and Burnett, but we're looking to really target our farmers, our migrant workers, Amish population, and some of our tribal messaging or members to create messaging that really helps them understand what is COVID, why is COVID important, or why the vaccine is important to get, and really just target on how it impacts their lifestyle, and also targeting the homebound. And from there, we are talking about having a strike team here from the health department between Burnett and ourselves, or partnering with a local agency to do some of those vaccines. And if we were lucky enough to get the Johnson & Johnson vaccine, that's where we would prioritize it to make sure that those hard to reach populations would get that one shot versus having to track them down for that second shot.
Thank you so much, and I hope you get to know Polk County from border to border. Just stay with the challenge we got now. Don't go up trying to get to Washington or someplace.
No, once it gets a little bit warmer out, I definitely, and more vaccines get out, and plus with this grant, we're gonna start doing some like target outreach at churches, or seeing if we can put signage at gas stations or grocery stores, places where people will see it that may think that help them think of people who may be homebound or may need us to come to them. So I'm excited to get out into the community when it gets a little bit warmer to do these things. So that's also, and also to meet people. I love people. So hence why I'm in public health. So I'm just overall excited.
Does anyone have any questions for you?
I have a question for you, and maybe it's for Kathy. One thing I heard yesterday from my postal carrier is how difficult it is for our overloaded postal workers to get away. I said, well, can you take half a day off? Because I don't have anybody else to cover my shift. So can we strike force to them?
That's one of those things I'll make a note, because we can also connect them with a strike team that we could get to one of our vaccination partners, or they may have extended hours, but we can specifically outreach to the postal workers to try to find a solution. I will work on that with the team.
Yeah, and then if you hear something that I should relay to them, that would be helpful. This is out of, Dresser, Osceola, St. Croix area.
They don't have. they don't
There's
have-
no backs, exactly. So they can't go.
Okay, thank you, and boy, are we ever lucky and appreciative, so thank you so much, and our relationship is certainly gonna grow. The next one, number 10, update regarding CAFOs. And I'm gonna take this one over. As you know, I'm a delegate to the Wisconsin Counties Association Steering Committee. I've had 2 meetings on the 5th and 11th. I have 2 more on this Thursday and Friday. And by the way, Friday is a steering committee strictly on health and human services. And I'll be here, I'll probably be set up either here or in Chris's office. It starts at 10 o'clock. It generally lasts, probably 3 hours. It's open live with all 72 counties. And let's see, Dan Barr is our administrator on Thursday. I'm not sure who it is on Friday, but if somebody from the department can sit in on with me on Thursday, on Friday.
Okay, yeah, I think someone emailed us about that, so.
Yeah. Lisa's got the agenda and I keep all the information. I did the other 2 live from Arizona and it worked really well. But both of these I'll have live up here. And get together on that. So last Thursday, Dan Barr was the coordinator, and that was probably the most interesting one. I would say half of that meeting was on, first of all, on the budget. And the way we're set up in Wisconsin right now, what was important on the budget is what's new for health and human services. And I tried to make notes on everything that would affect Polk County. But being we have a Wisconsin House and Senate, the budget is kind of a wish list, so I can't tell you that, this is gonna be the dollars or the programs or anything like that. But it'll be, they at least act on everything. And our Wisconsin counties is probably the most influential of the lobbying groups on our legislative side. So I got notes on the budget, that's the first part, but the thing that took most interesting was half of that meeting, probably an hour and a half, almost 2 hours, was on CAFO. And first of all, there was a proposed 2-year moratorium on expansion of CAFO. That is, I think most of you, Amy, and most of you are familiar with Bayfield County's proposed moratorium. And so there was information on most of the counties on that. There was a vote on that moratorium being, it's like our committees, when it's brought to the committee, when the committee approves it for advancement to the county board. Well, this here is our lobbyist gonna lobby with approval from the state body for a recommendation, and that goes pretty hard. But that did not pass. And that doesn't mean that, that still means that it'll be brought to the legislature, but it'll be brought to the legislature without recommendation. So from then on, and there was a discussion, and the biggest new thing that we have to realize, and what's going to be important, is a lot of this information, which we're trying to research and share you folks, is 10 years old, like from 90s, 2000s. Well, in 2020 now, they just completed a new soil testing area. And what is Iowa County, Grant County, and I believe Dane County. According to their test, the biggest thing that is affecting our water quality right now is like human waste. Sewer systems, every time you see a pumping truck or something, well, that's what we probably take for granted, that's deposited in fields and in some area. And the information that came out of those three counties, there's new, more dangerous things on the horizon that we got to deal with. And the number one challenge that came out of that study and research is what was that? It's not farm runoff or dangers in application. So there's going to be more concentration on that kind of testing. So that's as our legislature progresses. On the agenda, CAFOs will be on the agenda, and there'll be a lot of recommendations from DATCAP and different things. And but the as far as sponsoring a 2-year moratorium, it's not approved by the Johnson County. So that's what the open
Want to give an update for the non-board members where the executive committee and board action was on our CAFO assignment here?
I did not, I had the notes, and I did not left in a hurry that 4 o'clock Saturday morning. And I had that packet with me because I took down the notes on that. And Vince, did you sit in on that? Did you have any information?
Well, I think the main takeaway was the executive committee and then the board approved that staff should refrain from spending a lot of time on the CAFO operational ordinance. Does not preclude anybody, from this group or outside group presenting information that could be considered. But at this time, we didn't see a path forward in which the staff could put something together that would likely pass and be successful.
I guess the key to that, Amy, would be there isn't anything coming to the county board meeting tonight as far as any recommendations.
Just so you guys know that we had been working on it here as a committee. And then our work has been stopped. Executive said, you're done, and the board approved. I didn't vote for it, but, so.
I don't think that's what it truly exactly said. It didn't stop. You can still continue to work on it. It's just a matter of dedicating staff time, making presentations, doing research, not they just said, let's stop.
That's essentially the same thing, don't you think? I mean, we wouldn't want to do it without help from staff. It'd be.
Well, if there were an outside group.
Oh, I see what you're saying.
Representative, or, if you said, hey, really, I think we're close, and we said, okay, well, give us a roadmap of how to get there. We could reconsider.
Yeah, and I encourage people to, especially our committee, Health and Human Services, to keep on working and researching on that. And Fran, I've been in touch with you, and did you have something you want to present on water quality? I'll turn it over to you.
We've got it down later on the agenda, so I did have some questions when we get to that item. Unless you want me to address it now.
Yeah, I think now that we're comfortable with it.
Okay. Was just concerned, wondering what the status was with something we are moving forward with. In my mind, I did not see that as a connection to CAFOs. And so I was wondering if that kind of was something, I think that there was a disagreement, that there were other board members that saw that as connected to CAFOs somehow. Or, and since there was, the staff wasn't spending any time developing CAFO items, if that applied to this as well, or if we were moving forward with it.
I think, the staff, I think Bob was supposed to be here. So maybe if we discussed it later in the agenda, he was planning on coming in, but I believe we went ahead and applied for that.
Good,
Yeah,
good.
and
That's
and
good.
he was going to come and give us.
Yeah, yeah.
He was gonna give us a status report.
I think the big thing on a grant is trying to get things like I talked about, Iowa and Grant County, down there's huge population and large farms and things down there. And right now, there's 3 counties that the legislature is funding these grants. And so St. Croix County is one of these counties. The other 2 are some ways away. But we talked about this, I believe, on the executive committee too. That's why just, number 13, I think we're all kind of, it touches. And we're going to be looking very strongly at the water quality grant that St. Croix County is under right now. And that'll be very beneficial to us. And I would imagine some of the outcomes, look at the pluses and minuses, it might help affect the county getting the grant. There's something that is with us. I would certainly think so. So whatever you can present to us, Fran, you're open and
Sure.
appreciate your help.
Sure, there may be, perhaps I would need to touch base again with Dave Clausen. But he has potentially, some stage in this, some information.
I think what, when Dave didn't make his presentation to us, a lot of that data now is way back in 2000 already. Seems to be yesterday to me, but
Yes, 20 years
like when
old.
you have this new Iowa, and these new grants that are looking at dangerous plus and minuses in a different direction.
Yeah, and I think, in my mind, that's the most important reason for us to do this is because, from what I understand from the department gave their presentation is that most of the data we have is 30 years old. And so that's why I think this is so.
Dr. Locke.
Yeah, I really think that we should be pursuing viciously if we're able to try to get a grant, especially help people go for water testing. We also need to try to work with the Lakes Association, get them involved. I explain to them the importance of doing testing their own property, wells on their own property around the lakes. Sure that they're not contaminated.
I think that's extremely important because you look at all the summers that lake people are concentrated in one area.
Right.
And that's been proven a huge problem. And their associations are spending a lot of money now trying to get, Wapagassa now has their own lake district. Sanitary district. Joe, do you have any update on your Cedar Lake representation? The meetings that I used to go to, that's kind of a general topic, isn't it? Water quality. water quality. But.
I'm just thinking about a presentation for next week. Next time, maybe I'm jumping the gun, but that whole algal bloom that happened, that we had that health warning on, I'd love to know a little bit more about that and if we even can tie, where that's coming from, what's going on, what do we expect for this upcoming year? I don't know if that would be an Eric thing or you or.
Well, it's still on our website. So I had asked about if it could come down just because I was cleaning up our website, and Brian Hobbs said that that comes from Land and Water. And they must work with the DNR on that.
And they do, when Land and Water was in giving updates, I forget which meeting it was, but I specifically asked if they were working with the lake associations, and they said, yes, they did work closely with the lake associations too, so that was good to hear.
I mean, obviously, because in the summer, we get those all the time too.
Well, I'd love just some sort of update. I don't know who do I talk?
Land and Water, Bob.
Water.
Would you, who's,
So we get them on the agenda?
just one on the agenda for,
Good.
Sometime.
I mean,
Which meeting?
springtime coming up,
Yeah.
like the lake that I live on, Middle Pine Lake, there's, I believe, 52 residents, summer residents. I think half of us are year round, and we don't have an association. And our big lake, which is 3 lakes, Big Lake, Lower Pine, and Church Pine, they have an association. And then we're just separate. We're probably, less than a half a mile apart, but we don't have a canal or anything between Middle Pine and, what's the other one?
Lower Pine?
Yeah, Middle Pine, Lower Pine, there's 3, 4 of us that actually have a culvert, but we don't have an associate. We tried to get, I'm a representative to the Big Lake Association, and I had at their annual meeting last spring, had the referendum to try and get 6 of us together instead of just the 3 of us. Well, they turned it down, so, but I'm just an example of lakes that don't belong to an association. Should.
I have a question, since Bob isn't here. Could we get just a brief report from him emailed out to us, as long as we don't reply to all or anything like that?
Kind of an update on the.
Status of the grant?
Yeah, I texted him, and I don't actually respond, so I don't know what.
grant piece, and then how would we get this, who would we ask about this algae update for next? Would that be you,
I guess
me and
what-
Tanya?
You can ask.
I mean,
How
I
to get it on the agenda?
Uh,
Yeah, and if it's not in April,
I mean, do you just want an update or just how they do that? Or do you, because I mean, I feel like an update is just, usually if once it's gone, they just remove that. So I mean, what do you want? So they can.
I think I'd be interested in sources, why, what do we expect for this upcoming season? What are we doing about it?
Yeah, so not just specifically that, but just the general process.
Like, how can we go upstream and not have this
What
happen?
kind of algae are you talking?
What's the name of that algae?
It was, hold on, I'll look.
Where did this, like the lake I live in, and the lakes that we're familiar, there's no allergy.
No, there's a big algal bloom on one of our lakes that was, it's on the Polk County website. That's,
Right now.
It's been on butternut and it's been on half moon.
okay.
I know a lot of it is caused by the geese.
This was a different one that happened in the winter, which was abnormal, somewhat, I think.
Happen in private like ponds as well.
Twin Lake has had it up in Burnett County.
We had a little bit of a.
The study they did at Cedar, they thought that the runoff from Horse Creek was creating a lot of the phosphorus, and it's not. It was actually the bottom of the lake was creating all the algae bloom and stuff. Phosphorus.
That's extremely important on Cedar Lake. They thought it was a runoff for years and years and years. And all the algae was created in the bottom of the lake itself. But those are some of the new things that, and this new resource that's coming out of Iowa and Grant County, that study is gonna find new sources that we didn't know about before that are important. So maybe we gotta be so much broader than just saying, well, CAFOs causes this or like this geese study and things like that. We got so many.
This was on Loveless Lake and it was a species of blue-green algae called, I'm not gonna try to pronounce it. So,
Yeah, in Milwaukee, we had this toxic blue algae and before I left, I was working on a project to study more why our lagoon was producing some of this. So I'd be happy to bring some like public health recommendations on why this is a problem and what it does to our pets and bodies and what do we eat with it. I can provide an update and get you guys some more information. Specifically for that lake, I'm obviously not familiar with the area, but I'd be happy just to bring the public health aspect of why we have a water quality advisory.
So can you be that as part of our April agenda?
Absolutely.
Thank you so much.
so the other comment that I have just from the division part for CAFOs is that there are no current conditional use applications for CAFOs. FYI on that.
One number that I wanted to get from you that Tanya, I think, had was on the number of people in the hospital or number of deaths.
Two. There's two. I just looked. I was just out there.
Been pretty consistent at two.
Yeah.
Like,
Yeah, I guess I could just look out on our.
Okay. Just so we brought something up on that. Joe?
As far as what Amy's talking about is that we are currently at Cedar Lake, they did that elm treatment. And that's not something for everybody because it's very, very expensive. And the upkeep is very expensive. It's $2.1 million just to do the treatment. And that goes to get to 100%, they do a percentage every other year. Well, they started to have an algae bloom the year before last, so they did the last one a year earlier to get control on it. And then I can't remember what the name, it's what they go.
Aluminum. It's aluminum.
Yeah, it's aluminum oxide, yeah. They call it elm treatment. And
Comes out of Canadian research.
well, they got a company. There's only two companies that do the elm treatment. And I mean, it's tanker after tanker after tanker. But then we have a dive team come in and we got a couple problem spots that they tried spraying and it didn't really work. So they go down and hand pull them. And like I say, that's all added cost, you know.
John, Long Lake is currently doing that here. Well, obviously close to us off of I. They're currently doing it. The homeowners association is doing it there. And then Balsam Lake is doing it and they've sprayed East Balsam. And they're supposed to do that, I believe, in 3 phases. The interesting thing is, I think the Balsam Lake homeowners association is trying to save some money because what they did was they sprayed East Balsam first. And if you're familiar with the lake flow, it flows from East Balsam into the big lake and then over here and then out through the mill pond. So they're trying to get the chemicals flowing in a westerly direction, which I don't blame them, but that's been done. I think they were going to do that over a 3 to 5 year period. And what Joe said, it's extremely expensive to do that.
And the only ones that get assessed on it are lake owners and the watershed around.
Yep.
We're extremely fortunate to have our association.
Yeah.
And those organizations take care of that because that's a huge challenge for the county. Well, I appreciate, all the information that you board members can bring forth on what's happening in different areas. But the only thing we have left is there's number 11 we didn't cover on a nuisance ordinance update. Vince or
Yeah, Jean Schultz and Brian Hobbs from Public Health, they'll be working on the human health hazard part of that ordinance. I know they're working on that. So that's all I have for that update.
So let's have that on the April agenda. Right, did you have any information on anything?
Bob's here now, so wanted to ask him about the water quality grant status.
Should I go?
Yeah, you can go up there, Bob. Welcome to our March meeting, Bob.
Thank you. Yeah, forgive me, I know, need a report, but that's no problem. So is this agenda item number 13 then?
Pretty much, yeah.
Yeah, well, the grant award is April 6th, so that's why I don't really have much to report. Did submit the grant. I would assume that at your next meeting, we'll have some updated information. Just to recap, in the grant narrative, we are going to look at 3 watersheds. Again, Apple River watershed, Wapo, and Horse Creek. In the grant narrative, what we're going to do is test 11 well sites. So we'll be looking for some volunteers there. Hopefully we'll be able to test previous well sites that we've done in the past, provide that comparable. Kits will be paid for 100% with the grant. Analysis will be done by Land and Water. Then we'll also be able to do some outreach education regarding groundwater contamination, health concerns, as well as resources for those impacted. That's all I know. I hope we have good news by the 6th, and I can share with you our methodology going.
Are we doing 11 per watershed or 11?
100 per water.
Well, 100 per watershed.
Those 3 watersheds are identified in the Land and Water's 10-year work plan as high priority. It's really similar to the one we did in 2019. At a larger scale, that was just for Balsam Lake watershed. So just think of that exercise threefold.
Bob, did you?
3 watersheds again.
Yes, Apple River,
Horse Creek,
Pegasic, and Horse Creek.
did you have a chance to get any information on the March 5th Wisconsin County meeting?
I did. I wasn't here earlier, so I don't know. You reported. You were in attendance.
Yeah, I was on online on that, and it was on some things on the agenda that I called the clerk and I said, if you can refer this to Bob, might be helpful.
You know, coincidentally, I have the notes from that meeting. Thank you for the invitation, John. I appreciate it. I did attend.
The thing I brought to the
WCA.
meeting, the thing I brought to the meeting before, Bob, was they just came out with a water study from Iowa, Grant, and I believe Dane County. And the alarming thing they found out was what was the most influential on water quality was not runoff, was not manure or any of those species. It was human waste, pumpers from
Human
the
activity.
yeah, the sewer systems, whether they be drainage or whatever, but there's more people in rural areas, and they mostly all have drain fields or something like that. And that's going to increase, and it's showing up in our water quality. So that's the big thing on the horizon as far as those studies are right now. Everybody's got to be looking for new sources.
You think that the government's gonna continue to allow municipal to sewer systems dumping waste on agricultural land?
It's a problem right now. They're finding that out.
A lot of them like to put those in municipal sewer systems, want to be able to put it in municipal sewer
That's what
systems.
we're trying to,
But the thing of it is, for the municipal sewer water systems, they don't know what's in that pumper's tank.
correct.
They don't know what's in there. So if they get to put it in the municipal system, they may just kind of bomb that system with a lot of bacterias and a lot of other things that will pretty much cause it to not work effectively, violate permits and things like that. So there needs to be an in-between kind of testing of if the haulers want to put it in the municipal system, some kind of test of just what it is they're putting in there, so they don't cause the municipal systems to fail as well. So there's too bad there, hopefully some type of way of working together to do that. There are some municipal systems I know in this area that just kind of take this stuff right on. And there's other ones that are like, no way, we don't know what you're putting in there, and we don't want you to wipe out our system.
Well, they can't accept an outside liability.
Exactly.
When
Because the hauler's not gonna pay for it.
When I was farming, before you were around, Fran,
I don't know.
I had,
Been around a while.
I had 5 liquid manure pits on my farm. So I had 2,000 or 3,000 gallon tanks. And I contracted with the village of Osceola there for a while to haul their solid waste out on a DNR approved area. They're the ones that did the research. So they had an area south of Osceola. Well, that was the best fertilizer I had in my life. It was pretty cost effective, I'll tell you.
That's maneuver.
But it was a matter, of all the rural and the village and
Yeah, work
everybody
together.
working together, and it was cost effective and.
Bob, a quick question. I don't know if this is your bailiwick or not. So when you talk about municipalities, and their treatment systems, so how many, in the villages and the cities that are around, how many have primary, secondary, tertiary treatments that would be able to handle that type of waste coming from farms? Do you know just offhand? Because I know that
Probably gets done.
I could just go up my experiences, we would arrange for a hauler or a producer to a specific site to unload that waste stream into our system. Keeping mindful that there's an anaerobic
Right.
process. We would charge them. There's a fee structure for that. That's all I know.
okay.
This is just a general conversation, but it affects this same thing on the agenda. The village addresser, pumps all their sewers down to the village of Osceola, and they have a financial agreement. But matter municipalities working together.
Well, and the reason I asked the question is that there are, I'm not going to bring up any names, but I know that there are certain businesses in municipalities that pump into a municipal system. And a lot of time when you're using chemicals, bleach, whatever, that may make that system in that municipality go septic.
Polaris is one of
Well, I'm not bringing up any names. You live in Osceola, I don't. But, so I'm wondering, when you look at those municipal systems, what can they handle and what they can't handle to make them functional? For even waste that's coming out of a septic system.
The reason why I said that, Bill, is I'm in the Polk County Emergency Management. And any business that handles batteries or anything else. And so we only meet either quarterly or lately it's been just twice a year. And so there has to be a report to our emergency management committee. And if there's any spills, like any gas station or farm chemical, maybe you general people here didn't know that we're being regulated on all of that. So there is a handle on everything that happens in Polk County. If a farmer's out in the field and he overflows a tank or just anything that happens, it has to be reported. And
Supposed to be.
Yeah, okay.
Sometimes they just put stuff in the sewer system.
Yeah.
They do not report it.
Yeah, and it's no different than a municipality.
Testing comes up pretty quick.
Yeah.
Right, it's no different than having runoff from salt going into, the sewer system, and it just goes in. It has to go somewhere. Nobody thinks about it, but it has to go somewhere.
And there's another test in Polk County is, I brought this up before, I think last August. The wells that are checked in Polk County, those that are closest to Highway 35 or some of our major roads where there's more salt chemicals showing up in our water systems. I guess that's why we have Health and Human Services.
That's
Dr.
how we evolve.
Vargas.
There are things. You might check, I think that St. Croix Falls, that sewer system is probably you're probably familiar with that. Probably a multi-stage system in order to qualify to be able to discharge it in the river. Second thing, regarding the study that was done at Balsam Lake, have you had a chance to see if the Balsam Lake Association would be willing to encourage their members to repeat that study on wells, report any well testing that any of those people have done. Sure. See what information we can gather from the lake, including Deer Lake.
Well, with this project, we do plan to reach out with associations. Don't recall what outreach we did with Balsam Lake.
Yeah.
But it was a pretty robust reach out. Get volunteers to participate. I'm not sure if they work through the Lake Association or not. That is part of our methodology.
So Bob, we will have you on the April agenda and you'll probably have some more update. Appreciate what you bring to our meeting. It's always informative.
Thank you.
I think there's more information under that shiny top than probably we get from anybody else, so you can be proud of that.
Thank you.
But that's a sign of wisdom.
I think, well, it's from my wife hitting me on the head.
Hey, you're hitting you. Dr. Vince, did you have any other information to bring to us?
I don't think so. I'm taking notes for things that we can do. I'll be sure and we'll have Dean and Eric talk about the algae and maybe having a presentation at that April meeting on that. We'll have our waste study grant.
And I'll have some information. Hamilton County's steering committee, our big topic this is Health and Human Services Friday. And if any of you want to come in and share, and of course you'll be set up in one of these. Starts at, I believe, 10 o'clock on Friday.
Yeah, I believe so, yes.
Okay, anything else for our April agenda?
Do we know anything about the next legislative event?
Pardon?
Do we know anything about the next legislative event?
That'll all be coming on Friday. We have in Wisconsin counties, I'm on the county steering committee, and Friday is open. It'll be for all 72 counties, and I'll be up here, and we got to be recognized as being present, and we can bring resolutions to the steering committee for the legislative agenda. So we're one of the biggest lobbyists for the legislative agenda. Like last year, Polk County sponsored so what did we sponsor to the legislature last year? Remember?
Was it a 3 strikes, you're out?
Yeah, correct. It came from our public service, 3 strikes, you're out, amendment, which, it didn't gain support of the, steering committee, but it did, come to the legislature without recommendation.
Are you bringing anything on Friday?
Not bringing anything from this committee. And I'll probably bring to the committee something that has happened. Well, yeah, this is similar to what we have, or this is the initial thing in Polk County. I usually have some kind of from our county, because we need to be active. You gotta be at the table and you need to be active, otherwise, you don't get any recognition at all.
What I was asking really was about the legislative events that we've been having in New Richmond quarterly. Are we still looking at having those meeting with our legislators, or?
Good point. Now, Rob Baffled.
Yeah.
Be our senator now.
Yes.
I know Gage Magnifici is in Madison today. And so they're still working on, I think they have their committees appointed. But they're in the process of organization. So that'll be my question. That's with Bob or Kay every month. And we need to be setting up. One thing I know that did from our steering committee, I think that was on the 5th, in the governor's budget, we're trying for a long time to get Northwest Wisconsin a central health facility. We looked at the Baldwin Hospital, which is torn down now. They did finally fund a place in Eau Claire. I think we're going to be seeing this year for the Wisconsin, whether it's somebody in our department that is can be just about anything. Could be arrested for alcohol and so many times. Well, they need to get outside treatment, or it can be from our social services and our jail system. There's people that need to go on to treatment, and lately, for as long as we can remember, it's always been down in Winnebago, yeah.
Even Eau Claire is far. And for them to consider Eau Claire in northwestern Wisconsin is kind of crazy, because Eau Claire's, what is it, 2 hours? An hour and a half?
At least that's not an overnight
Oh,
facility.
I know.
But John, is there any way that you and the county can push some kind of a mental health treatment facility in Rice Lake or Eau Claire? Because right now, if they're full of Sacred Heart in Eau Claire, they have to take these people to Winnebago. 55, I don't know what the law is, 55 point something. Full, because basically I can't order a hold on somebody. Somebody has to come to our law enforcement has to come to our emergency to make the decision whether they're a threat to themselves or others. Then they have to transport.
Would be for the committee, what Dr. Lagus is referring to is we used to have this facility at Cumberland. And ever since the facility closed at Cumberland. They've never came up with an alternative.
We have Amory inpatient behavioral health in Amory. And they used to be just geriatric and now they've gone down to all adult. They're often full and we still, we do have that as an option.
Yeah,
We need something regional that is huge, like Rice Lake or something that. Those are little things that are on our budget that we don't realize that it can really
They're
be
extra
astronomical.
expensive for the sheriff's department, and it takes the deputy out of here for the whole day. And the second thing is that our alcohol treatment facility, essentially L.E. Phillips in River Falls.
Chippewa Falls.
Chippewa Falls.
So I think
Thank
the
you.
bill you're talking about, they're proposing 22 new beds in the Chippewa Valley, which would be between Eau Claire and Chippewa,
Okay.
is what they're proposing.
That doesn't suffice northern Wisconsin.
Well, whatever beds we can get, it will help. And so it's kind of, it's a first step, and certainly I hope the county association support those efforts. For the citizens.
I'll try and bring something up on Friday. In fact, make a note of that. What would we actually, what was the name of the facility we had at Cumberland?
Cumberland Hospital.
Isn't it Northern Pines? Yeah, Northern Pines is the facility.
That was the multi-county.
Multi-county,
That's the
yeah.
name of it. And then the Cumberland Hospital provided.
I know the chief psychiatrist. was there. He's at St. Frederick now, early Mayo.
Where did that go?
They just run out of funding, and
Counties didn't want to
when I first got on
fund it.
Human Services back in 1996. At every meeting, we had a person from Cumberland. He was one of our people agenda. And back at that time, we had somebody to bring as a regional the problems and help us directly with the problems and things that you had. It was a huge resource. And it just dried up and caused us more problems.
I'm also on the Wisconsin Medical Society Legislative Committee, which is Friday up. But I think that one of the things that physicians of Wisconsin like to see expansion of the Medicaid program. I don't know where they're on that. Maybe somebody knows.
I'll make a note, thanks, I'll make a note of that for
Because
Friday
there's a
too.
lot of adults without kids who are not doing very well. They're not coming in because they don't have insurance. They're not getting their preventive medicine stuff. They're not getting healthcare issues dealt with. So we need to lower the income levels to the point where we get more people into that program, because there's federal money available to fund that.
There is money that isn't being spent.
In Wisconsin, though, they refused that
I know. But that was
free money.
a previous governor who refused to accept that money. So we now need to convince our legislators of both parties that they should support this for the well-being of the people of Wisconsin.
Oh, what we're gonna.
Because that's the only way you're gonna get people back to work. You gotta have a healthy populace, get them to work, and or you're gonna get the economy rolling. Get the economy rolling and get people immunized.
This is the biennium legislature, and what that means, second term, and Democratic governor. Like I said, Wisconsin House and Senate. We're gonna have to try awful hard. We're gonna have to be in touch with all your legislatures.
Yeah.
Hey, this is just not, we need this for bipartisan.
Right.
We're gonna have to maybe get support as a community. that said, this is action from our county. They'll listen to any kind of phone call or letter or email or anything before they'll listen to anything as they actually stay active. Anything else for our April agenda?
Yeah, one more thing. Kathy, would you check with Tanya? I think Birth to Three and the Children's Waiver Program was going to make a presentation. I think they were going to do it in March, but I think they had meetings today that they couldn't do it, so they were going to postpone it to April.
Yep, so Lee Wallen, who is the Director of Department of Children and Families, along with Marissa Lindsay,
Yes.
she's a lead social worker. So it's not Birth to Three, that's in public health, but they will be coming and
Yes.
along with Chad Hoyt for child support. For
Oh,
April.
okay, perfect. Thank you.
So for April, Tanya and I and Madam Clerk will be working on the agenda. You have your calendar there. What date in April is our second Thursday?
Right now it's April 13th.
That's pretty close to the 15th. That should suffice. So our next meeting should be April 13th at 10 o'clock, and happy spring. Sure that'll work by that motion to adjourn.
Oh, we could have another snowstorm.
I'm scared still.
So moved.
Trail.
Second.
Moved and seconded, Madam Clerk, all in favor, aye.
Aye.
Thanks for all your information, everybody.